Kayla, I'll be the nurse working with you today. Can you confirm your name and date of birth?
Penelope Garcia, February 16, 2005.
Okay, and do you have any allergies?
No.
And do you consent to being on video?
Yes.
Okay, perfect. So Penelope, can you tell me what date it is today?
October 31st, 2025.
Okay, and where are we?
At the doctor's office.
And what are we doing?
A checkup.
Okay, so today we're going to be doing a cranial nerve exam. It will just be me performing some tests on you from the neck up. Is that all right?
Yes.
Okay, perfect. Let's get started. We're going to start off by testing cranial nerve number 1, which is the olfactory nerve. I'm going to have you close your eyes, occlude one nostril, and if you can smell this scent, let me know what it is.
Okay. Vanilla.
Okay, now occlude your other nostril.
Cinnamon.
Okay, perfect. So patient is able to identify aroma on each side. Now moving on, we're going to be testing cranial nerve number 2, which is the optic nerve. I'm going to have you keep looking straight forward, and when you can see my hands, say no.
Now. Now.
Okay, so patient shows that she has a wide range of peripheral vision. Now I'm going to have you close your left eye and recite row 8 on this chart.
TEFPOTEC.
Okay, and I'm closing your right eye, recite row 9.
LEFODPCT.
Okay, so patient recited both rows correctly, which shows that she has a good visual acuity. Now moving on, we're going to be testing cranial nerves number 3, 4, and 6. These are the oculomotor, trochlear, and abducens nerves. So looking at the patient, I see that she shows no signs of strabismus and ptosis. And now I'm going to have her look in this corner here. Okay, now look in that corner. Okay, now look at the tip of my pen light without moving your head. Okay, so patient's pupils are round, equal, and reflective to light and accommodation. Now I'm gonna have you keep looking at the tip of my pen light without moving your head. Okay, perfect. Patient shows no signs of nystagmus. Okay, moving on, we're going to be testing cranial nerve number 5, which is the trigeminal nerve. I'm going to have the patient clench her jaw. Okay, so both muscles are strong and equally bilateral. Keep clenching your jaw. Okay, the chin is very strong. I'm unable to open it as I'm pushing down. Now I'm going to have you close your eyes, and if you can feel a touch, just say no.
No. No. No. No.
Okay, perfect. Moving on, we're going to be testing cranial nerve number 7, which is the facial nerve. I'm going to have the patient smile, frown, puff out your cheeks. Okay, both sides are strong. So the patient's facial nerves are intact, and she shows no signs of Bell's palsy. Now moving on, we're going to be testing cranial nerve number 8, which is the acoustic nerve. I'm going to have the patient close one side of her ear and recite these words.
Car, shoe, road.
Okay, now include one side, the other side of your ear, and now recite these words.
Phone, bus, house.
Okay, perfect. So patient recited these words correctly, which shows that her acoustic nerve is intact. Moving on, we're going to be testing cranial nerve number 9, which is the glossopharyngeal nerve. I'm going to have the patient say ah, ah. Okay, so I see that her uvula rises symmetrically, and it shows no deviation on one side or the other, as well as her tonsils area. So for the purpose of this video, we're gonna be skipping cranial nerve number 10, which is the vagus nerve. So now we're gonna move on to testing cranial nerve number 11, which is the spinal accessory nerve. I'm gonna have you keep looking straight ahead. Okay, now shrug your shoulders. Okay, both shoulders are strong and equally bilateral. Okay, so now turn your head to this side of my hand. Okay, now turn your head to the other side of my hand. Okay, both sides are strong and equally bilateral. Now moving on, we're going to be testing cranial nerve number 12, which is the hypoglossal nerve. I'm going to have you stick out your tongue. Okay, perfect. So the tongue is midline, symmetrical, and show no tremors. Now repeat these words: light, tight, dynamite.
Light, tight, dynamite.
Okay, perfect. So the patient is able to clearly say these words, and we were able to hear the L, T, and D sounds. Okay, so it appears that all cranial nerves are intact, which is a very good sign. So do you need, or do you have any questions about the procedure today?
No.
Okay. Do you need anything from me before I go?
No.
Okay, perfect. Well, thank you for your time.
Thank you.